Hi, my name is Joy Richards, and I'm the Vice President of Health Professions and the Chief Nurse Executive at UHN. And I'm so excited to be sitting in front of this camera talking to you about something that's really close to my heart. My dad lived for many years with dementia, and so I know firsthand what it's like to be given that diagnosis. I know the stigmatization that happens, and I know the sense of hopelessness. And it doesn't have to be that way. The Bitove Wellness Academy is really a state-of-the-art new way of thinking about living well with dementia and building on people's strengths even though they're going through a difficult time of loss. This program has been designed very specifically to pull out the very best in people. It's about art. It's about intergenerational. It's about playing to the strengths that are intuitively built into the muscle memory of people who have dementia and actually having fun. So, as part of this program, I've been really fortunate to be at it from the very ground level. I've been able to work with Dr. Gail Mitchell and the Bitove family around bringing this vision to life. And I have to tell you, in all the things I've done in my career, this is the one thing that actually is going to be the thing I'll remember the most. I know that for many of you, you're living with diagnosis, you're trying to understand how best to manage. But this program is designed as an innovation hub for us to learn together, learn from persons living with dementia, how best to be able to support an environment. It's coming to school. It's not about coming to a program that's going to be illness-based or working on your symptoms. It's about how to live well, how to enjoy life, how to dance the dance of life, even though you have a few limitations. The other nice thing about this program is that we recognize the success of the participants and the scholars that are in the program need the support of caregivers. And so equally important in this program is to wrap our arms around and create a loving, nurturing environment for caregivers who can ask tough questions, who can get the information they need, and so that they can live well as they're supporting people living with dementia. So I hope that you're coming to the program and learning something every day. We're in partnership with you. We're going to learn together about how best to care for and provide meaningful life and life experiences for folks living with dementia, and how we can together take the notion of such a bad diagnosis and moving it to a place of fulfillment and life and vitality, and helping to maintain those skills well into the severity of the disease. I believe that by an innovative focus of working with nurses and other health professions, that we're able to untap some unused resources or ideas that we hadn't thought about that will help to maintain and even improve some of the functions that perhaps your loved one or yourself are struggling with at the moment. So welcome. We're looking forward to learning with you, working with you, and developing something that I know is going to be a state-of-the-art way of thinking and celebrating life, even though it's through a lens with dementia.
Hi, I'm Gail Mitchell, Professor of Nursing at York University and Director of the York UHN Nursing Academy. And I'm really excited to be involved with the DOTSA Bitove Wellness Academy. As a professor of nursing and a researcher, I started working with people who live with dementia and memory loss about 30 years ago. And I soon realized that their lives were not like medical textbooks said they were. I learned that even when people have dementia, they still have a lot to offer. They still live lives in very rich and meaningful ways. They still grow and develop, even though there are incredible losses and difficulties that are undeniable. We have decided that honoring people, honoring the lives that they live and the people that they are, is worthy of some serious effort and study. And so this Wellness Academy is going to be about how do people who live with memory loss keep living? How do they keep expressing who they are through the arts? How do we create spaces so that people can learn more about themselves and about each other and about their relationships? And how can we create space for respectful, non-judgmental living together, growing together? And that's really what the Bitove Wellness Academy is all about. So I started to do research with a team of researchers and nurses and recreation therapists and philosophers to try to better understand what is quality of life, what does it look like for persons who happen to be diagnosed with dementia. And people with dementia have taught us a lot about how life continues. They have taught us that one of the most important things to them is being treated as people, that even though they have an illness and some memory issues, they are still the same person. They want to be treated as people and included in activities and treated with respect. They've taught us that life slows down and it's hard to focus, but they still learn and create ways to help themselves cope with the memory loss. One of the really interesting and exciting things about the Wellness Academy is that we're going to be doing research here. We're going to be generating new knowledge about how life continues and how relationships unfold. And we have a program of research that we're planning on intergenerational education. And what we're going to do is have young people, children, young adults, students from nursing and fine arts come and work with the seniors who will be coming to this center. And we're going to be looking at what are the important aspects of relationships for both groups and how do they relate to each other to enhance each other's life and understanding. I wish we could keep talking, but I do hope that you will come and learn about the Bitove Wellness Academy. It's going to be an amazing place. We have wonderful people who are working here and students and faculty, and we're really excited about welcoming people in the community, people who live with memory loss, and students and partners. Thank you.
Hello, I'm Nadine Cross, and I'm the Research Associate for the York UHN Nursing Academy. The Nursing Academy has been instrumental in working with UHN and the Bitove family in the development of the new Bitove Wellness Academy. My interest is both as a researcher and also as a daughter of a man who lived with dementia. He lived with dementia for 2 years, and it was a trying time for all of us, including the family. But one of the joys of the time with my dad was a moment when we were able to sit and sing together, to listen to music, music of his past and music of my past and present with my dad. At that time, I saw my dad cry for the first time. I had an opportunity to laugh with him as he remembered, although maybe not told me what his remembrances were. So it's a joy to be able to be involved with an arts-based program such as that will be established at the Bitove Wellness Academy. Well, what is really interesting for me is the philosophy of the Bitove Wellness Academy, that it is both arts-based, and we will have visual artists, musicians, playwrights, improv, actors, all different types of arts, but also that what we are trying to practice and will practice is the relationality. Is how are we in relation, both the staff and the faculty, with the participants and their family. It is the relationship that is fundamental to the work that we do.